Hello everyone, I'm Dr. Kasem. I practice in Claremont, Florida. It's like 30 minutes north of Disney. I've been in practice for 12 years. I've been placing implants for about 5 or 6 years now. I am a board certified diplomat of the International Congress of Oral Implantologists. I also have the privilege of speaking at University of Florida, Temple University, and Nova University, where I get to teach a lot of things like digital dentistry, robotic implant placement, and we also have an implant continuum course that's under UF at St. Petersburg in Florida. So we teach a year-long continuum there for anyone that's interested in learning about everything from single implants to all on X. And I also coach dentists. So that's a little bit about me. Tonight we're talking about how I'm transforming my patients' lives through robotic implants and how I'm using Yomi to really change their lives. This patient here, this is actually one of my favorite reveals where we took Gail, and she's got a great story. She's actually a retired periodontist assistant, and for 50, 60 years of her life, her periodontist scared her and said that she has perio and gum disease and bone loss, and she's not able to have implants, so she better take care of her teeth. And so for almost 60 to 70 years, she religiously came in for 3-month perio maintenance and recall. And one day she finally called and she was really upset. And she said her tooth was falling out, and it was her front tooth, number 7. And she said she didn't know what to do, but she can't have implants. She doesn't know what to do. And I said, Gail, come in. Let's see if we can do implants on you or not. And her case is particularly challenging because she has really narrow ridges. She has like 4 or 5 millimeters of width of bone all the way across her maxilla. So I knew I would, in order to do her case, I would really have to, every single one of my implants has to be in bone. The angles have to be correct. I'd have to use densa burrs, versa burrs, and I'd have to expand the ridge. And her case has to be perfect. And she's also a retired dental assistant, so I knew that I was going to do something like FP1 and sculpt and scallop her gums. So I'm going to show you guys a little bit later what her case looked like, and you can kind of see how we were able to get a really beautiful outcome on her. But the cooler part of this story for me is the day that we scheduled her case was actually the day that a Category 5 hurricane was hitting 2 hours west of our town, and it kind of sped up, and it was supposed to land the next day, so we thought we were okay. And she comes in and she's like, hey, are you still going to do my case? I'm like, I'll do it if you want to do it. And she's like, I'll do it if you're going to do it. So my team, we all stayed, and we ended up doing her case, and we were able to do it fast enough because with Yomi I can really get these osteotomies down perfectly, but I can get them done really, really fast and accurately. And we started and finished her case from 9 a.m. to 11 a.m. And the bigger take-home message here is her reaction. I mean, you can look at her, how she's laughing and smiling, and this is her first time seeing her teeth right after surgery. So I'll show you a little bit more about that later, but I just think that this is the magic that we can create with Yomi and robotic guidance. So the biggest question I always get from people is, why should we get into robotics? So for me, like with Gail's case, it's to increase the accuracy and quality of my cases. So I'm obsessed with accuracy. I really want to get really high quality results for my patients. That's what they expect of me. And if I do that, I can also be very minimally invasive. So they have less pain and they react really happy, and they look in the mirror and they love the way they look. That also relates to better prosthetic outcomes. I do a lot of FP1 and cosmetic cases, and what that means is my implants have to be aligned to like the lateral positions, and I need lingual screw access. I don't want to see facial screw channels. I really can't make 1 tooth really thick or have an implant come out of a connector. So I'm really excited with Yomi that I'm able to get perfect placement pretty much all the time, and my prosthetic outcomes have been a lot nicer. And that means less fractures and less compromises when it comes to aesthetics. Another thing that I really like is that it helps me do guided bone reduction, and it also allows me to do crestal sinus lifts with a lot of confidence. We can get 15 to 20 millimeter lifts with almost 2 cc's of bone. That's kind of like a result you would get from a lateral sinus lift. And we can do it with almost no collateral damage or trauma to the patient, so they don't have a lot of pain and all of that, post-operative discomfort. It also saves me a lot of time and cost. I used to design my own guides, and I used to 3D print them, and I would sit here all night and I would create like 10 or 15 guides every week. And it was eating up a lot of my personal time, nights and weekends. And so now I can do same day cases, and I'm able to have a patient come in, take a CT, and then I ask them, hey, do you just want to go ahead and do the case? And they're like, yeah, I'm already here, why not? And so that also serves as a marketing tool. A lot of patients come in and they're like, I saw your story on the news. You were on ABC News, you're on Fox News, and you were able to come, that we wanted to meet the guy that's got the robot. So that's helped me grow a little bit. I'm going to show you some details about that tonight. And also, we can do same-day implants like I was talking about. Patient comes in, they want to do an implant, and we can go ahead and do it right then and there. And my most favorite reason of all, and I'm going to show you a lot of cases today, is that I can do the most complex cases. So a lot of cases that get turned away, like Bob, I'm able to do where no one else would dare touch him because the case is too risky and everything has to go perfect. So let me tell you about Bob. And then I'm going to show you a video where he tells you his own story. And this one gets me a little bit choked up. I get tears in my eyes because he's really close and dear to us. But Bob presented as a new patient, and he wanted to do dentures. And I said, Bob, I don't think you're really going to like dentures. I always tell the joke that I failed that class in dental school, or I'm allergic to acrylic. I can't do them for you. But if that's something you want to do, you can, go somewhere else. He's like, well, what can you do? And I said, I think we can save some of your teeth. We can maybe remove them all, do an all on X. We can do some implants in the back. There's a lot of different fixed options that we can do. But if after hearing what I have to say, you want to go do dentures somewhere else, then, have at it. He goes, all right, well, walk me through it. And so, so we presented the case, but the issue was that he hid something from me on his medical history, and he didn't tell me that he was a stage 4 liver cancer patient. He didn't tell me that he was on terminal chemo for the rest of his life. And, he just said, well, I want to do dentures. And I said, okay, so, we'll refer you out. And he called me back 3 weeks later, and he says that, hey, I want to come in and I want to do the implants with you. And no one has really quite spoken to me like you have and given me the time that you have. And I really liked the way I felt. And I said, okay. And so I said, what's your why? And he goes, well, so this is the part that gets me a little bit teared up. But he says that, out of him and his 7 siblings, all 7 of them had cancer. And he said 4 of them passed away recently. And there's only 3 of them left. And he said that his dream was just to go have a family reunion and have pizza with them. And he says that when he was little, when they were kids, they would eat pizza every single Friday night. And there was only 3 of them left, and they wanted to meet and have a family reunion. And it had been 50 years since any of them had been together. So I had to get his teeth all fixed up and get him up into New York, where he's from, so they could have pizza. And then he told me that his wife told him not to waste his money and to leave it for the family. And I said, it's your money, you do what you want to do, but I think I could get you out of pain and reach your goal. So once we did our medical clearance, he goes, the doctor tells me he's on chemo. And I called him back. I'm like, Bob, why wouldn't you tell me that? And he said, well, because I was rejected by 13 practices and you're the only one that treated me like a human being. I said, okay, but I need to know. So long story short, we were able to talk to Shands at UF in Gainesville, and we talked to his oncologist. We got clearances, we figured out a drug holiday, and we did the case, and I was able to place a couple of maxillary implants, and we restored the rest of his lower teeth. And he came back and he told me a story, and he tells me that he was able to get up in enough time to eat pizza with his siblings, and a week or 2 after that, his last remaining siblings passed away. And so I'm going to let him tell you that story real quick. Do you remember what our food goal was?
Yeah, eating a rib steak.
Yeah. And then it was the New York pizza?
Oh yeah, we got there early.
Yeah.
Right. It was the first time family had been all of us together in 50 years. So, because when we were young, we had every Friday was a pizza night. And so we had our reunion, had our pizza night. And we had a good time.
So you were able to go up there in enough time to
Enjoy it.
yeah. So then he says something on camera that I couldn't believe. He says that, you know, both siblings passed away. And I want you to pay attention to this part. So this is my why. This is why we do what we do, and we invest in the technology to try to help patients that no one else would touch. He says the best part of having this cancer was meeting you guys. So I want you to hear him say that. And then your brother passed.
So they're in my story. Yeah, the best part about having this cancer was meeting you guys. I could have had it, but
Well, that's not how long you give up. That's the best thing he's ever said.
that's all you get.
Yo, we were all fighting over you every time. Yeah. But you're like, who's gonna go grandpa?
You like it all of it.
This is your fault. It's always your fault.
Because it felt like that from day one.
So that's my most favorite reason for why I like to use Yomi and really push the boundaries of what's possible. And then magic like this happens. So guess who's now in remission? So they were able to shrink his cancer down. I know this isn't about Yomi and implants, but this is what my life's purpose is to be part of these patients' life stories. And so he told me they were able to shrink the cancer down to 1 node, and then they zapped it with radiation, and he actually went into remission from stage 4 cancer. So just to make him laugh and feel like this again and actually help him when no one else would, this is probably my #1 reason. So here's Yomi. If you've seen it in person or played with it, it's a really fantastic piece of equipment. And there is a tracker arm. That's the thing most people don't understand. They're like, well, what if I move? And what if the patient moves? So there's a tracker arm that links to the patient. I'm going to show you how that works. And then you have the robotic guide arm, which uses haptic guidance to place the handpiece and position it in the exact position so you can place the implant exactly where you want it to go. I'll show you some videos of how exactly that works on live cases. You also have a planning station and then this screen that you can watch the actual implant going in. And a lot of times the patients really like watching that. I'll have patients that, this is really funny, but they'll kind of drift their face over and they're like, you know, I don't know why Yomi's moving, and I look up and they're looking at the screen and their whole head is drifting over, and with the tracker arm, Yomi moves with them so they can watch if they want. It's not a big deal. So what exactly is robotic guidance? To me, robotic guidance reminds me a lot of when a car has like lane keep assist or that physical guidance where you kind of drift off and it vibrates and pulls you back in. So it's kind of like that, but a little bit more precise. It can also use GPS, which would kind of be like your CBCT and your pre-operative plan of where you want the implant to go. And it will combine the two to get the implant to take you, or take your car or the implant, it'll take you to the exact destination that you intended. And this video kind of shows that. So you can see in this graphic video, the drill kind of locks in, and then the surgeon is able to place it. And then the best part about it is it has depth control. So the drill is going to stop exactly to the 0.01 millimeters of where the implant depth was intended to go. And this is really important in the mandible where you're drilling right over a nerve, or in the maxilla where you're near the sinuses. So you have a lot of control, and I always show patients that, hey, you can really push on this and it's not going to go any further than where you plan for it to go, even if you shake your head left and right. And this is an example of that. So here you can see the mannequin model moving left and right, and then the drill, no one's touching it, but it's able to follow that position in X, Y, and Z coordinates. So that's robotic guidance. And why is it important? It's important because a lot of times we can be a really good surgeon and we get really narrow areas of a curved root or a narrow ridge in the maxilla, and we think that we were able to place the implant perfectly, and you take an x-ray later and you realize that, oh, I'm really close to the root, or I nicked this, or I'm too far buccal. So we have a lot of challenges when we do freehand placement. When we use static guides, there's a lot of challenges too. I used to do a lot of guides. I don't really miss them. The biggest thing was space restriction. You stick a guide in there and then you're not able to place these really long drills and have the patient open big enough, and you can't get posterior implants, especially angled ones. And you can't get irrigation around a guide, you have reduced visibility, and you can't make any changes. So if you're doing extractions with immediate implants, a lot of times you'll break a buccal plate and you think the implant is going to go there, and you have to move it to a different position. So with Yomi, I'm able to relocate the planned position to where I still have bone or a better site that I found, and then I'll have the robotic arm guide me to that site. So it's a little bit better than a static guide in that regard. And then with navigation, I've tried some of the navigation systems, and those don't provide any physical guidance. What they do is they will kind of guide you by line of sight, and you have to look at a screen. You can't look at the patient, you can't look at the implant site, and you have to look at this target, and it turns green, yellow, or red. And by the time you bring the drill over, you have to kind of angulate it, and then you can't, you know, it'll tell you that you're getting close to the depth, and it's all really based on you. So it's really similar to freehand, except you can't look at the patient. So that's a little weird for me. Then I also found out that they guarantee about 8 or 9 degrees of divergence from your intended path, and I don't like 8 or 9 degrees divergence. That's going to mess up my prosthetic outcomes and my screw access holes and my screw channels and my aesthetics and all of that. So anyway, those are some of the limitations. So I'm going to first show you guys the single implant accuracy. So what Yomi can do is, I'm going to show you this video real quick, but what's happening is it's kind of showing you how the arm is able to lock into the X, Y, and Z coordinates and then into the angulation. And then as it enters the osteotomy, it will stay at that exact intended target, and it's only going to move to that 8.5 millimeters of depth in this particular video. And you can't over drill. You can't drill to the left, you can't drill to the right, you can't get the angle off. It's really, to me, it's like magic. So I get really high accuracy with that. And I'm able to get another bit of accuracy, which is my torque. So a lot of times, if I can time it right, I'm able to get that implant to reach the exact torque at the exact depth of the implant placement. And this is what this video shows.
11.5. At it.
So in that video, and I'm going to show this again in a different accuracy slide, you hear 2 sets of beeps, and there's my implant motor going beep, beep. So that's telling me that I reached my torque limiter, which is 50 Newton centimeters. And then Yomi goes beep, 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 and that tells me that I'm at depth. So that's the picture at the top of the screen. The implant was able to reach the intended depth, and the implant motor told me that I reached my intended 50 Newton centimeters of torque at that depth. So we don't always get this, but it is cool to see this, and it's not something I've ever experienced before when I was doing guided or freehand surgery. So imagine getting accurate torque at the accurate depth of your implant. You're going to really overcome a lot of failure points. So this is something that's really exciting for me, and that's one of my reasons that I enjoy using Yomi. I do a lot of full arch cases. We do 2-3 arches a week, and what we see with the arches is where I plan to place the implants, my designer gets super excited. He goes, man, the implants are exactly where I told you to go, and it aligns with the wax up, and the screw channels are perfect. And that's really hard to do with incisors when you want those screw channels to come out of the cingulum of an incisor, like number 23 or number 26. If you get that wrong, then you're going to have a really wide tooth, you're going to have a big angled MUA, and the designer's going to hate you. The patient's going to say, what is this big lump on my tooth? When I talk, it rubs my tongue. So I don't like those complaints. So I'm really excited about the fact that I get full arch accuracy. So I put this video together to show you guys. So what you can see here is the red outline. That is my STL file of where I plan to place the implant. And then obviously the white shadow is the X-ray or an extrapolation of the CT. So I'm going to play this video, and you're going to see me roll around every single one of the implants, and you'll see the intended path and placement of the implant is in red. And every single one of the implants that I spin around, the red and the actual outcome of the implant are aligned in the X, Y, and Z coordinates and in angulation and in depth. So on all 5 of these. So maybe sometimes this is not important. Like this person had a pretty wide ridge, but in her particular case, this last implant, I needed to place it right over the mental foramen, and I was able to get to 1.3 millimeters away from that. So sometimes it does really count, and other times it's just for accuracy. It's just for yourself, you know, to know that you did a good job. So a lot of times when we do this, the benefit is I can be very minimally invasive. I don't have to do really large flaps, even for bone reduction. And a lot of times I don't have to do flaps at all if I can plan the case around it. So this is important when we have other patients that are very challenging. So meet Elizabeth. Elizabeth is that patient that comes in your practice and she's super sweet, but she comes in and she checks every single box on your medical history. Like everything is a yes. So she's got Sjogren's, she has an autoimmune disorder, she has rheumatoid arthritis, you name it. This is the kind of person that, you know, you really want to treat, but you're afraid to, because if you touch her, give her a hug or a high five, she flares up. She's that kind of person. Well, she came in and she was able to, actually, I'm going to show you her case and then I'll come back to her.
Hi, I'm Elizabeth.
I'll play her testimonial, but this is her case. And we were able to do an all-on-6. So we placed 6 implants in the top. All of her teeth started to form decay underneath the old crowns and bridges, and she started having mobility. And you can see the before and after. So these red ones are the intended position of the implant. And we were able to get that positioning on the X-ray on the left of each of the red images. You can see that the implants are exactly where we intended, and we were able to keep a very small thin of that buccal shell. And I knew I needed a tool that would give me an extremely high ability to achieve accuracy. And, you know, to me, it's like playing darts. It's like you got to hit bullseyes every single time, especially for a case like this. And in this picture on the bottom, this is the immediate pre-op and immediate post-op. So I feel like we were able to really preserve the gingival architecture, preserve the papilla, preserve those root shields. And the only one spot was over here where she had a little bit of swelling. That area of the gingiva was already a bit swollen, but this ended up healing great. And we've had her, we did this case, I think it's almost 2 years old, and it's still stable, and now she's coming in to do the lower. But I did want to play this for you. You can kind of hear, this is the take-home message. You know, again, I'm about patient stories and about making their day. That's my goal. Whether that's with implants, with Yomi, or with a prophy or a hug, it doesn't really matter to me as long as they're happy. And it's really hard to make a patient happy when you do all on X, because they're going to be in a lot of pain and swelling and bruising. And we all know that from the healing cascade, your pain and bruising shows up around day 4 through 6. So nobody in their right mind does a post-op on day 6, but we did. And listen to what she says.
Hi, I'm Elizabeth Gonzalez, and I am just got done with week 1 after getting my I don't know what you call it, the bridge
implants.
yeah,
An implant bridge. Yeah.
And I am doing amazing. I didn't have any major pain, just a little soreness. And I actually have some medical issues, and I haven't had any flares or anything this week, so I'm doing really great and feel really good and love my teeth.
Awesome. Thank you, Elizabeth.
So that's the outcome that we get, and we get this like 3, 4, 5, 6 times a week. It's pretty predictable. It's repeatable. If you can learn certain surgical skills and be minimally invasive, your patients can be this happy, and I don't have to hide from them on day 6, which is when they're supposed to be bruised and swollen and in pain. So this is kind of one of my biggest reasons as well, is to be minimally invasive and make people happy. You don't have to take my word for it. We do have a couple of articles. You know, accuracy is supported by evidence. So we actually have Dr. Newgarden, who did a really nice study of over 300 implant cases, and we were able to find that this was significantly more accurate, placing implants with Yomi versus any other modality, and especially when it came to angulation and depth and standard deviations. So this is a really nice article if you guys want to take a screenshot of this and look it up. And it really helped convince me that accuracy was supported by clinical evidence. And another benefit of being this accurate and being minimally invasive is you can have fun with your patients. So a lot of our patients have a slightly quicker recovery. We can immediately load our implants, but we can also then take them to finals in about 3 to 4 months. In some cases in the mandible, you can do it in even shorter time if your implants can integrate faster. So when you can have those results, you can do this. So I'm going to show you a couple of patient cases again and some patient stories. So this is Brian, and he had a motorcycle accident and he broke his maxilla. So he lost all his front teeth, and we had to rebuild and graft him and using titanium mesh, and we rebuilt his whole maxilla, and then we placed implants. And the whole time he's like, when can I eat solid foods again? When can I eat solid foods again? I said, Brian, do not eat anything. It's going to fall out. Don't touch this bridge. Don't touch the temporary. Just let it heal. He goes, I just want a chicken wing. That's all I want. So it took 10 months to finish his case. It was a little bit more involved. But on the day that we delivered his finals, we had to surprise him with chicken wings. So this is what we did.
Yes.
Last April.
I know. You had mentioned to it, and I thought, you know what? You, it's for you.
Yeah.
You
Yeah,
do
that
it.
one's warm.
I need about 30 of these, but I don't think.
So we're just having fun, and I just wanted to reward him and make his experience memorable. But the issue was, as we're delivering his final, I had a double arch all on X here in the background, and you know, he just had his surgery, had all his teeth replaced and upper and lower. I think we did 12 implants on him. And when you come to my practice, it's like my house. And so you guys are all my guests, and I feel bad. Like I got to feed people. I have to treat them like family. So I can't feed Brian chicken wings. And then I got Joseph in the back, and he's hungry and he's staring at us like, why the hell are you guys eating chicken wings in a dental office? Plus he just had surgery and he's waiting on his temps to be printed. So I thought about it, and I'm like, you know, you're not supposed to eat solid foods for 3 months, but you only live once, right? And again, I want to make the patient's day. So I said, well, 12 out of 12 of Joseph's implants had over 50 Newton centimeters of torque, and with the Austel, they all read into the 70s and 80s of ISQ. So I knew I had really high stability, and we did FP3 on him, so I knew the provisionals were going to be really strong, and I said, let's take a chance. And also I felt really rude that I fed Brian and not Joseph, so this is what I did. You like chicken wings? Yeah? You want to try one? Have you been able to bite into a wing like all these years?
With a knife.
Oh, the knife?
Yeah.
Let's bite into one. You want to try it? All right. Just got we microwave some for you. I know you're a little numb,
I
but
think that's a spicy.
yeah, I hope you're okay with spicy.
Yeah.
How long has it been?
Good for you.
Yeah. Not bad, man. First day in the afternoon, you're already eating. Yeah. Take these home.
Thank you.
You did awesome. So I don't recommend that you tell your patients to go out and eat, but sometimes you got to live a little and show them a good time. So that's another one of the benefits. So let me get into my robotic workflow. It's just 5 easy steps. And first we plan the case, we place the link. I'm going to show you what that means. We scan the patient, we do the surgery, and then we restore the case. And my most favorite part is restoring it, because that's when we get those patient outcomes and the videos, and they get to eat and smile, and we all cry tears of joy. So that's like the best part of what I do. So the first stage is planning. And you can see in these videos, the planning software, Yomi Plan, is actually really easy to use. You can merge STLs. you can take your CT scan and align everything, and now you can do prosthetic planning. So we usually do a pre-prosthetic wax up, and we merge that to the STL of the pre-op scan, and then we merge that to the CT, and then we place the implants according to that. So that's how we're getting these outcomes. Rotating and aligning the implants is super easy. You just click the tooth position and then drop down to your implant brand of choice, the size, place it, and move along. You can do that right from the Yomi station. I usually do it from my desktop computer, and I don't know, it's just a lot of fun and very easy to use. And then you saw from the full arch case where I did the overlay of the STL with the actual CT, the results were really accurate. Now, once you have the pre-plan, then the patient comes in and you have to attach them. I always tell the patients this is like the Matrix, where Neo gets the thing plugged into his head, but we don't want to plug something into someone's brain. So we put a tray on their teeth. So there's two types of links, and one of the links is an impression tray. That's the one you see on the screen. And we put some bite registration material and we attach that to a neighboring tooth away from the edentulous site. And then we're able to attach that to the tracker arm that I showed you. I'm going to show you that again here in a second. And actually, I think I can play it. And then Yomi can now feel where the patient is and move the drill arm in a relative position to the tracker arm, and then that's how you get your accuracy. The other type of Yomi link is the Yomi bone link, and that's for full arch cases. That's the video on the bottom left. And that gets drilled right into the bone, into the alveolar bone. And it's super easy to use, just takes like a minute to set that up. And then you place the link, attach the tracker arm, and you're ready to go. There is a step that you have to do. Let me show you that really quick. Actually, before I do that, I just want to show you in real life how the Yomi arm, the guide arm, moves with the tracker arm. So look, as the patient's moving left and right, the arm is moving with her, and it's fixated on that implant position. So it's not going to lose the angulation. Turn to the left, and to the right. Good job. So once you have the link on before you do surgery, you do have to attach this black fiducial array. It's got little glass beads on it, and you take a CT of that. And on the bottom left, you can see those little glass beads floating. And now you import the CT into Yomi, and Yomi is able to kind of triangulate the position of the patient in real time. So it can take the patient's CT and know where the positioning is, and now that same Yomi link that I showed you earlier is attached to the tracker arm. So Yomi can feel the patient and see the patient. And so that's your lane keep assist and your GPS. And this is how Yomi is able to find out exactly where it is that you want to place your implants. So it's super easy. So you take your CT, now you're ready to do surgery. So this is my second most favorite. It is a lot of fun driving Yomi, but it's still not as fun as restoring the patient, which I'll show you next. But this day is super fun, and most of my team, they fight over assisting over Yomi. They're like, someone else is driving the robot. I want to be in there. I want to be in there. So it's kind of become this thing that they bicker over. But this is what it looks like. And it is a team approach. So it's kind of fun. You can have one chairside assistant helping suction and, you know, passing you instruments and all of that like usual. And then the other assistant is driving the robot. So she's guiding me to tilt and angulate the handpiece and move it into position. And then I'm also telling her, hey, free up the arm. So I'll say free, she says free. And then I say guided, so lock me into the position. So she says guided, and she guides me into position. She says locked in. And now I drill, and it stops exactly where I told Yomi to stop. So it's pretty straightforward. And I wanted to show you that effortless accuracy, as I call it. So here's an implant going in. The implants are self-tapping, so as Yomi's position basically can guide the implant itself. Still a good idea for us to hold on to the drill. So I'm just using one fingertip to guide this implant to the perfect position, and you're going to hear those two sets of beeps, so pay attention. So again, you heard that beep. That's 50 Newton centimeters of torque on my implant motor. And then you heard the beep, beep, beep. That's Yomi saying at depth. So I was able to get, in this particular case, 50 Newton centimeters of torque exactly at the depth of the implant placement. So that I really think is a lot of fun. And then another thing I like to show is this is actually my training week when I first got Yomi. My trainer, Daniel, who's a good friend of mine now, he says, hey, let's do a full arch case on your first day. I think you can handle it. And I said, okay, if you say so. I didn't know he was recording, so he sent me this video later. But this is on my first day of using Yomi. I did 6 osteotomies in 60 seconds. I wasn't really trying to go fast. It just kind of showcases how easy the equipment is to use, even for a beginner. So this patient was a lower all on 6. So I'm doing 6 osteotomies on the lower mandible.
23 guided. Loop angle. Locked in. Adjust. 26 guided. Keep going. Other direction. Keep going.
Also note that the patient is not under sedation. She's just not even Valium. It's so minimally invasive, she just wasn't worried about it. And we're able to do this full arch on her and spend very minimal time in the operatory getting this case done.
Okay, keep going. Lock in. Adjust.
Boom.
Come on.
I guess that was 58 seconds when he says boom. But anyway, so you can do 6 osteotomies in 58 seconds. I'm sure some people are even faster than that. But remember, it's not about speed, it's about accuracy. So I'm able to get speed and accuracy. So that takes me to, I did want to show you a couple of other features. So this is the guided bone reduction feature. So here, what you're able to do is in your Yomi plan in the CT in 3D, you can draw your nerves, and then you can prosthetically calculate how deep you need to reduce your bone. And you can set limiters, and I can say, okay, I want to reduce 15 millimeters from the occlusal plane. And then on the bottom right, you can see this purple outline where you can trace the arch. That's going to prevent you from accidentally slipping into the floor of the mouth or the tongue or those soft tissues, which can sometimes happen as your drill rolls. And so this is going to prevent that, which I think is a really nice feature. You can also set these posterior boundaries and say, hey, I don't want to go anywhere past this. So once that happens, then all you have to do is load up your straight handpiece, place your bone reduction burr, it locks in just like the other modules, and now it's going to let you move in that horseshoe shape that you outlined, and it won't let you go beyond any of those markers. So for people that are a little bit timid around bone reduction, this is a really nice tool. For those of you that are not timid, but you just really want better surgical results, like a flat plane of reduction, and a really nice flat bottom prosthetic, this is a really nice way to do it. And it's a repeatable way, so you can get this result every single time. So this is a little fun story, since I threw a lot of clinical stuff at you, but I had a patient that came in and he was super scared, and he thought we were going to flay him and reflect his tissues all the way up to his nose and under his chin and put him to sleep and all that. He didn't know that we could be so minimally invasive. And so this is the story of TJ, and at the end of the surgery, he goes, hey doc, I didn't realize like how minimally invasive this was going to be. Like, you didn't put me to sleep, you didn't tape my eyelids shut, you didn't strap my arms into the chair, and we're already done. I don't get it. I'm like, yeah, well, I told you, I told you that this is how we do surgery here. And I asked him what he thought, and he said, well, his daughter's an anesthesiologist, and she scared him and said that, hey, they're going to tape you down, you're going to wake up mid-surgery, and you won't be able to move, and you'll feel everything. And so it kind of made him postpone surgery for 5 years. So I'm sure a lot of you have patients like that, where there's some objection there that you can't uncover, and it keeps them from getting surgery done or from the goal that they want to accomplish. So what happened was, one day after 5 years of me presenting this treatment to him, he disappeared, and he showed up, and he said he was on a date and his front bridge fell out. And he's like 76 years old, and he's dating all the time. I love it. He's just a good talker. And he said that like his bridge fell out while he was chewing, and he had to run to the bathroom, and he couldn't finish the date, so he left out the back door, and he just kind of ditched his date. And so he came in the next day, we did the case, and he was so elated. He was so happy that he goes, doc, can I buy you a beer? And one of his best friends is a retired dentist. I didn't know that. And I said, okay, you like to hang out with dentists? Sure, we'll go out one day for a beer, no big deal. He goes, no, I mean like right now. And I said, no, TJ, we're in surgery. He goes, no, you're done. My case is done. You're just waiting for the teeth to be printed. So, what's the big deal? And I said, all right, as long as no one finds out. But technically we were done for the day. And we went next door, and right next to our office is a Tijuana Flats. It's like a Florida chain of a taco restaurant. And we snuck out and we got a beer together, but my assistants caught us. So we recorded this video I want to share with you.
Drywall,
What are you two doing?
We just got out of surgery and we're enjoying a beer together.
Absolutely. I'm waiting for you girls to come over. Can we get you a couple of chairs?
So I show this video because, again, you can have accuracy, you can do implants, you can have really nice prosthetics, but if the patient isn't having a good enough experience to buy you a beer or brag about you or refer people to you, then what's the point of what we do as a profession, right? So I like to show this one. Now, back then, it used to take me 3 hours to print an arch. Now we can do it in 5 minutes, so there's no more time for a beer. But I just want you to kind of take this point home and make sure that this is what your goal is and you're really there to make your patient's day. So that brings me to my favorite part, which this. So this is the restorative part. So these are the results that I'm able to get. So I promised you I would show you Gail's outcome. So this was her 3D printed prototype where I was shaping the papilla and the tissues, and we were able to preserve all of that. And this is her reaction. Keep in mind there's a Category 5 hurricane 2 hours away, and none of us are worried about it. Gail's not worried about it. We're all happy. And we had a really great outcome. My puppy was in the office that day. Here's another case that we did recently, another FP1. I mean, look at the gums, the tissues, the papilla. The patient is ecstatic. He's coming back to do his lower arch. He came down from out of state to do this case, all the way from Virginia. Every time I do this, I'm jealous of their teeth. Maybe I need to get all on X. Their teeth look really good. Here's my lab team. We just have a really good time the day that we deliver. And this young man, it was his wedding, and he had a motorcycle accident. He knocked out his front 2 teeth, and we were able to do a same-day case on him. And, it's really just about making this experience for the patient. So that's my all-time favorite thing, is when we can finally deliver the teeth and we get the result that we promised them in the consult. There's really no feeling like it. This is an old chart. I need to update it, but it kind of shows you over the course of about 2 years, 2.5 years, where I used to do single implants and arches with 3D printed guides. Then we integrated Yomi, and our full arches and implant cases started to go up. And we didn't really change much except presenting Yomi as a solution for patients and then marketing with it. And a lot of patients sought us out and said, hey, I heard you're the robot guy, or I saw you on the news. And I'll show you some cases like that. So we made it into the Orlando Business Journal. We had some news articles about us, and then we actually had 2 different news stations show up to our office. We had Channel 9 show up, and they said, we heard that you're doing robotically guided surgery, and we've never heard of that. And we heard that that's the same kind of stuff that they use on the space station, and we want to film a story about you. So I said, sure. And so here's a short clip of that.
And I would do it all over again if I had to. Just the change in my life and my confidence, no more pain. My colleagues have noticed it, my family has noticed it.
So that's my patient Azel. We're best friends now, and we were able to do upper and lower all on X on him with 6 and 6 implants, so 12 implants total. And he's a car salesman. And since the day that we did this case, 2 things happened. One, the morning after, he was walking his 7-year-old daughter to the school bus stop, and he was able to do that because it was so minimally invasive. He didn't really have much pain. And he said that his little girl ran up to all of her friends on the school bus and was jumping up and down, and she was so excited, and she was screaming to them, my daddy looks like Tom Cruise. My daddy looks like Tom Cruise. And he came and told me that during his checkup. I checked on him a day later, and he goes, yeah, this morning my daughter was so proud of the way I looked, and he started crying and I started crying. And I said that he's his little girl's hero, and imagine how he feels. And so that confidence carried through to his workplace. He's a car salesman, and he's averaging 40 to 42 cars a month. And those are dealership records, those are state records, and he's just killing it with this confidence. And then he goes on the news and he says, I would do it all over again. So then Fox News hears about this and like, we want to do this story too. I'm like, heck yeah, like the more the merrier. So they showed up and they said, I have to pick a different patient. So I had a patient that came in and she was really ecstatic to talk about some single unit implants. And she actually said that it felt like she had a cleaning done. So I'm going to play this for you.
After her procedure at Restoration Dental in Claremont,
it just felt like I didn't have much done. Like I just had like a cleaning done or something, So it was a quick recovery.
So imagine what that could do for your practice growth and marketing strategy if your patient gets on live news. And that story's been airing for 6 months. I still have people saying that, in technology hour, they're like, hey, this patient said that she had implants done and it feels like she had a cleaning done. Like it was so minimally invasive. So I feel like that's really helped boost us. And so if you look at my practice growth, when I bought the practice, we were around 600,000. And in the last couple of years, we've been growing about at a rate of 1 million a year. And in 2024, we implemented Yomi. That was the big change we made. And this year, we're going to end somewhere around 4.2 or 4.3 million. So I really think that this has made a big impact, and it's really helped set us apart if used correctly. If you can present this as a solution to your patients, especially for the more difficult cases, for the more aesthetically challenging cases, what you're able to do is present this to them and let them know, hey, your case is a little more difficult, but we're going to need a tool that's going to help us achieve a higher degree of accuracy. Or a patient that says, hey, I'm in a lot of pain, I'm scared of having more pain. You can say, no, we're going to be very minimally invasive. We're going to place all these implants through little microscopic pinholes, and I might not even have to do any incisions. And right away, they're like, sign me up. So I think that's been a really big change, and you can kind of see this 35% growth pattern as a result. And I want to show you a case that we did just last week, just for this presentation, to kind of put some human emotion behind those numbers. It's not all about numbers and how much we produce and collect. It's really about how many lives we can change and how many smiles we can create, and how those smiles can now create a ripple effect throughout the universe. And these patients can go and uplift other people and inspire them to be better. And if I can teach other doctors to do this, now I can have more doctors reach more smiles, change more lives, and we can create this really large ripple effect throughout the universe. And this is the ripple effect that I'm talking about. I want you to hear this story. Smile really big. Look at it. It's beautiful.
Beautiful. My name is Kimberly Cruz Paget. I started having a lot of dental issues really young, but really in my 20s, I started to have some serious issues, started losing teeth, and it was really expensive to get it fixed, get them done. It affected everything. It affected my confidence, my speech. And so it was over 20 years of just feeling like I had this huge burden I walked around with all the time. My life has changed. I seriously, I don't think anyone knows what it's like to live 20 years of your life, like hiding. Because I am an extrovert. I want to talk to people and everything. And that's the first thing people see is your smile. And you want to smile at people. You want to be able to talk to them and, and you want that confidence. And so, I don't know if I could ever fully articulate how I feel. I don't know if I could ever say like what it's done. I don't know how to put that in words right now because I'm still surprised. It wasn't something I wasn't sure that this was going to happen.
1, 2, 3. There we go. I can't.
can't believe it. You did get it better. Oh my God. They look so real.
I told you, it's like you have veneers.
Diogo, like, I can't, that's me. I can't believe it. I mean, they look
Real teeth.
like real teeth. All of you guys are so special. You guys are amazing, and I just pray nothing but the best for you all, always, always, in every area of your life, because you guys changed my life. And I hope that if I can do one thing for you guys, is to send as many people to you guys to say, go get your life changed. Go get your life better, like I did. Go to Restoration, go see them. So thank you for everything. Thank you. That's, I honestly, if there was a word, I'll have to pray about it because I don't know what to say.
So this is our why. This is why we do what we do. And, you know, it's not about implants. It's not about robots and about production and marketing and all that. It's really about affecting and impacting our patients' lives. I get really choked up when I see these things because this is why we exist and this is our purpose. So we did Kim's case 2 weeks ago, and this is an immediate post-op, and we were able to get her into zirconia within 10 days. And these are still provisionals. We'll probably still finalize it and tweak certain things, but I mean, we're able to do results like this, and then you can look at the tissues and look at her smile. And that video was shot 10 days post-op. There's no swelling, there's no bruising. She's super happy. And we filmed this just for this presentation. So I hope that can really impact some of you and help you answer the question of how many lives will you transform when you have the right tools in your hands. So thank you for joining me on this, and I hope this helps.